for Regions 19 and Regions 1B. We appreciate you all being here with us tonight. Tonight's session will be recorded, which you might have just seen in that announcement, and it will be posted on our Birth to 5 YouTube channel following the event, so you can share that link with anyone who was unable to attend or watch it later in case you missed something. For our Spanish speakers who are with us tonight, we have live Spanish interpretation being provided. I'm going to pause now for a minute for our translator to give you those directions on how to use that service this evening.
This is Olivia. You'll be able to find the interpretation feature at the bottom of your screen. If you choose your channel, would be either English or Spanish. I am. Are you able to hear me?
Yes, we can hear you. If you want to give the instructions in Spanish, I think that would be best.
Jess, I cannot hear Olivia.
Yeah, they would have to pick a channel for them to hear me. They would have to pick the English channel.
Please bear with us as we get the tech together here.
Hold on a second.
And reactivate it after everybody's picked the channel.
Can you all hear me?
Yes.
Okay, on the bottom of your screen, there's a little globe looking button that says interpretation. And so if you want English, go ahead and pick English there. And she's going to give the instructions also in Spanish.
We still cannot hear on our line though. Maybe David, can you help us out here?
Yeah, I'll jump in. I'm going to go ahead and switch over to Spanish. So para los que necesitan español, sí tenemos traducción esta noche para la presentación. Si usted baja a donde están sus opciones, a mero abajo en su pantalla va a haber interpretación con un globito, una esfera. Si hace clic allí, va a ver que tiene las dos opciones de inglés y español. Nuestro traductor está en el canal de español. Si gusta unirse a ese canal para escuchar todo en español. También si está en su dispositivo móvil, es igual, nada más toque la pantalla y van a salir sus opciones y sigue los mismos pasos. Va a haber interpretación, hace clic en español y confirmar, me aparece en la esquinita de arriba y con eso se va a cambiar al otro canal de audio de español que tenemos ya listo.
All right, thank you so much for that, David. We also are going to be offering closed caption for those who want that service this evening. If you look on the bottom of your screen, there is a button that says CC/live transcript. Please go ahead and press that now and you will be directed to that feature. We apologize in advance for any errors. The transcription is provided by Zoom. We changed our format for tonight from a live town hall to a live webinar to make sure everyone has a high quality experience. As I mentioned earlier, it will be recorded so everyone's thoughts, everyone can look over there later or share that with their team. Our goals for tonight are very simple. We want to introduce you to the Birth to 5 state team, share more about the work to Birth to 5 Action and Family Councils, and answer your questions. Some of the information tonight may be familiar to some of you who have attended events before, but there is lots of new information we're providing, so please be patient with us. While the chat feature is open and we welcome you to use it, we do ask that you put any questions you want us to answer tonight in the Q&A button. There's a Q&A button at the bottom of your screen and you can put your questions there. We will answer those live tonight, and we can also put some messages in the Q&A function for you to hold on to. We will be answering questions tonight in the following order. First, the ones that were submitted to us in advance of the event. Second, any questions that come in the Q&A box, and then we'll go ahead and you all can raise your hands. We'll unmute you and take any live questions you have tonight. We go to the next slide, please. Since we've started Birth to 5 about 6 months ago, we did make an effort to define our vision for people so we can set ourselves apart and be clear in what we're doing. So our vision is reimagining a more equitable early childhood care and education system that ensures family and community voice is centered and prioritized at every level of decision-making in the state of Illinois. Our next slide, please. And our mission is to create a statewide regional infrastructure that will amplify input from communities in the development of policies and funding priorities. We mobilize communities to build and sustain equitable access to inclusive, high-quality early childhood services for all the families and children in the state of Illinois. So those are big goals and visions, but we think with your partnership, we can make those happen. Next slide, please. Here we want to just expound on our values and goals. So as you see, family voice, racial equity, and collective impact are the three that we're focusing on. We define family voice as through the transformation centered on authentic family and community engagement. We will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care system. And our racial equity work is in an effort to move our early childhood education and care system to one where race is no longer a predictor of a child's success. We will address barriers that have limited access to high quality services for minoritized children across our state. And we're using a collective impact model for this work. Birth to Five will build a system that harnesses knowledge directly from families and mobilize decision makers to ensure new and/or expanded services are created to meet the needs of the community and directly influence policy, funding at the local, regional, and state level. So again, this is all in partnership with what's already happening in community and what is yet to happen in community. Next slide, please. For those of you who have been involved in this work for a long time, you know that we had to build a team from scratch, and so we are almost fully staffed. We wanted to introduce you to that team. Myself, as you see, I'm the state director of Birth to Five. Sonia Clark is actually on another call right now for another couple regions. She's our director of operations. Jess is on our call right now. Jess serves as project coordinator. Any emails and website and graphics and things like that that you love, that's credit to Jess. Maggie is on another line now with Sonia and is our communications manager. Dina is also on that other call right now. Dina serves as our family and community engagement manager. David, who you will hear from tonight and is on our call, as our family and community engagement coordinator. Angela is rounding out the current team and will serve as our grants and community relations manager, implementing the funding we have for local collaborations that will be launched later this spring. We are also currently adding 2 more to our state team. We'll have an admin as a part-time person, and we are looking for a data analyst or strategist. Both of those jobs are listed on Anchor right now if you know anyone who'd like to apply. Next slide, please. Also on our call tonight is someone you all might have become familiar with, Karine. Karine is the area coordinator for Area 1, which covers 19 and 1B, which are here with us tonight. We have Dana. We have, I'm sorry, my screen is so small here. Can't even see the slides. We have Dana, we have Jackie, we have Lori, and we have Kim covering the rest of the state. They have really been our boots on the ground as we've been building this program and this state team. And so you might have engaged with Karine or even maybe someone from another region, but if you have any questions, Karine's available. If you can't reach Karine, we're always available at the state level as well. Next slide. So just going to recap what we're doing here at Birth to Five. Birth to Five is a partnership between the state of Illinois and the Illinois Network of Child Care Resources and Referral Agencies, which many people call INCRA. They launched Birth to Five, just as I said, about 6 months ago, and we're tasked with creating the Birth to Five action councils and family councils across the state in 39 regions. We are actually now just aligning with Chicago, and so that will be coming online just later in April. That will be the Every Child Ready Chicago Council that's already in existence, and now will be aligning to be the regional council for the state. Our councils will share the geographic boundaries of the state of Illinois regional offices of education. So that's the map you see there. We'll share the geographic boundaries, but we will be operating independently and in partnership with those offices. There are several important goals for our work. We want to make sure we support local residents in coming together to address early childhood needs within their community. I think that was clear in our mission and our vision. We also want to make sure the state's priorities and funding policies and funding priorities match the needs of your region. We want to prioritize what the community, what families and providers are telling us they need and what they desire in their communities. We also want to provide equitable access to high quality early learning services for every student throughout the region whose family chooses to participate in the service. We welcome people of all experiences, all ranges of experiences, those who are new to advocacy, those who have been in the field for a while. We need every voice to help us make this possible. We are currently hiring for regional action council managers throughout the 39 areas. As I said, the Chicago work is a little bit behind, so that will start in April. Those managers will oversee the formation of the council along with the state office and all of the management of the supporting staff, as well as the work and product of the council. There are some job openings that I mentioned that are open. I think Jess has put in that link in the chat for you all if you want to take a look at those and share those with anyone else. I'm now going to transition this over to my colleague David, who I introduced you to earlier. He's going to take us through the work of the councils.
Great, thank you, Cicely. Good evening, everyone. So happy to be here. So happy you're here. Now we're going to jump into talking about the councils a little bit. We're going to talk about the Action Council, followed by the Family Council, and then a committee that we're looking to help us fill who's going to make up these diverse groups within the regions. So let's start talking about the Birth to 5 Action Council. So on your screen, you see some of the key roles we're looking to fill within that Action Council. These are the local stakeholders that we're looking to tap to be a part of this council. We're looking to have about 15 members in the Action Council, and it's varied like you see here. I do want to point out the first one, they're parents and family members. Parent voice is the foundation of the work of Birth to 5 Illinois. So it's very important to us that we have parent representation within the Action Council. We're looking for educators, family child care staff, local district superintendents, board members. We're looking for local or county elected officials, healthcare, faith community, anyone in the community who is interested in this early childhood landscape and really just building the early childhood landscape within that region. So this is a very varied group, but like you see there, we're hoping to fill a little bit of everything within this group. So next slide, please. So what will the Action Council actually do? So the Action Council is that leadership team, right? That's going to be providing direction and vision for the regional work. It's going to identify the gaps. It's going to amplify that family voice, work with any local collaborations or coalitions that are currently doing this amazing work, communicate a lot with the community about what's happening within the Action Council and within the Family Council. They're going to collaborate with us, the state team. They're going to collaborate with the Early Childhood Transformation team and other state entities to help collect this information. They're going to conduct a regional scan. Right, and that's going to be the big task right when we get started, is collecting that regional landscape of what the early childhood picture currently is. So with that, they're going to create an annual report. And that regional scan I will mention is within this first year of forming these councils. Next slide, please. So some of the requirements, commitments that we're looking for the Action Council members: must live, work, or receive early childhood services within the region. If you perhaps work in a different region than where you live, we ask that you just apply for the Action Council, which you think you would make your biggest impact, right? We're really looking for people who are passionate about where they're from, where they live. And so we want to make sure that you feel that you can make the biggest impact where you feel is going to be the most important to you personally. This is a volunteer leadership role. We anticipate about 2 meetings per month for both the Action and the Family Council. There's a 1-year commitment. We're really ideally looking for 2 years. You can sign on for a 1-year commitment and then decide later to join on for your 2nd year. Why 2 years? Because we hope to continue to change the people in these councils as the landscape changes and things evolve within the region. We want to continue to make sure we're getting that diverse voice and those perspectives from everyone. So right now we're saying a 2-year commitment is what we're hoping to achieve. For those 2 family members that I mentioned in the Family Council, we are going to be providing a stipend too. So I'll talk more about that when we transition to my next slide, please. So the Family Council. So who are we looking to serve on the Family Council? Families with children under the age of 8 and our experiences in early childhood education and care systems. So again, we want to hit the priority populations. This is the foundation of the work of Birth to 5. And without that authentic parent voice, none of this work is really going to get us anywhere. We need to make sure that we cover the regions that have been underserved, like I said, priority populations and just reaching everyone who maybe has not had the opportunity in the past to speak up about what might be important to them or needs that they might have in order to reach early childhood services. This council, the Family Council, will also have around 15 members. If we start with a little bit less than that, that's okay, and we will build up. We want families to feel comfortable and feel like they're committing to something that is going to be very meaningful to them. And my next slide, please. Yes. So what will the Family Council do? So this is the advisory committee in a way to the Action Council. They're going to share the input, give the feedback. They're going to advocate for the families that might not be sitting in that Family Council. They're going to gather feedback from other families, right, who are not in the council, but maybe their neighbor, maybe their friends who are also wanting to give some feedback into what is happening within the birth to 5 realm. They're going to identify gaps, raise issues of concern from the community. So they're going to be working though in tandem with the Action Council to make sure that they're listening to each other, they're working collaboratively to build, like I said, that regional scan that we're going to be looking for within the first year. Next slide, please. Perfect. So what are some of the requirements, commitments for the Family Council? We're looking for that, I said, authentic voice, authentic family voice, a diverse group of people from all experiences or no experiences too. Maybe members of the Family Council have not been able to participate in any early childhood programming. We want them in there as well. We want to hear why. This is a paid leadership position. Like I mentioned a little bit ago, there will be a stipend for those who participate in the Family Council. We anticipate the same, about 2 meetings per month for the members of this council. And again, we're looking for ideally a 2-year commitment, starting with 1 and then signing on for your 2nd year, but also want to rotate to get, again, continued voices of programs that may be disappearing, coming up, and always having the most up-to-date information of what's happening. Next slide, please. Okay. So the selection committee. So how are we going to select the people who have committed to these councils, right? Who have applied and filled out an interest form, I should say, for these councils. The selection committee is something we're looking to start up in each of the regions. We're looking for just a couple of members who are saying, you know what, I don't know if I can commit for a year or 2. I can give you maybe a couple of weeks, 2 to 3 weeks, like you see there. After applications close, we would have a selection committee go through these interest forms and really, again, with a list that we're providing, help us create that diverse voice, that diverse group of people from all experiences to reflect the region. So no one on the state team will be looking through these to make sure we're going to have people from that region. Now, you would, to be a part of the selection committee, we ask that you haven't applied for either the Family or the Action Council. And again, we ask you that you live, work, or receive services within the region. So that's very important. We want the people of the region to be able to uplift their own councils and be a part of that process. It's very important to us. Next slide, please. Perfect. So here's where I'm going to pass it off to my colleague, Corinne, who's going to talk to us about the partnering with community collaborations who are already in place in these regions.
All right, thank you so much, David. And as mentioned earlier, I am the Area 1 coordinator. So thankful to have my Cook West and DuPage County people in the room. Birth to 5 Action and Family Councils, as we've talked about, are going to partner and work as partners with local collaborations throughout the state, both to help them build capacity where possible and to also share information regarding the future planning as it relates to early child care in the state of Illinois. The Action and Family Councils are not looking to replace or duplicate the work of the local community collaborations, because we know the work that you all have been doing has been impactful. Ultimately, our goal is really to make the community work easier with a new governance and funding model for early childhood education and care statewide, one that's actually based on the needs of the young children and their families. So for those organizations that are already working on the regional level, we know that our leadership team has engaged in those conversations and are aligning those efforts. In areas with more localized efforts, once hired, the regional staff are going to look to build on the work that those collaborations are doing by ensuring that gaps, barriers, and expansion needs that they've already identified are highlighted in the regional scan that David mentioned earlier. In addition, through this work, there will be new efforts in engaging families and providers that have historically been left out of this process. And so it is our hope that Birth to Five Illinois is seen as part of the community system and an additional ECEC advocate. Finally, one of the really exciting things I think is this $1 million funding opportunity that will be launched in the spring to help collaborations regain and increase enrollment in early childhood programs, especially programs that saw decreases in enrollment due to the pandemic. So more information is going to continue to be shared as it becomes available. If you could go to the next slide. So next steps and how to get involved. Both Birth to Five Action Councils and Family Councils will be community driven. And so we're providing the infrastructure and support to ensure that there is equitable representation on both councils created within each of the regions. We are ready to stand up councils as soon as the community is ready. So now what we need from you and others in your community is to complete the interest form or to refer others to the interest form so that we can see where there is interest and where we need to increase our outreach efforts. You can complete an interest form for your region's Birth to Action Council, Family Council, or Selection Committee. All of these forms are available, specifically Action and Family Council interest forms in English, Spanish, and Polish on our website, which you'll find in the link in the chat. And the Selection Committee interest form is available in English and Spanish and will be made available soon in Polish. So we ask you to continue to visit our website, which is also available in English, Spanish, and Polish to learn more about our work and how you can get involved. And we want to encourage everyone to definitely visit our frequently asked questions page, which was updated with the answers to the numerous questions submitted to our team during our virtual regional kickoff events early in February, as well as in anticipation of our live webinars that started this month. Next slide, please. Next slide, please. And so as we get ready, just wanted to again remind everyone that anyone who is interested is encouraged to apply for one of our open positions as we are building our teams. We are currently hiring 39 regional action council managers, one in every region across the state. And again, the position for the city of Chicago will be posted after our kickoff event, which takes place on April 6th. We are looking for an administrative assistant to join our state team, as well as data strategists to support the data needs of the regional action councils. Again, remember that you can subscribe to Birth to Five Illinois to get email communications to stay in the loop, and also connect with us on social media platforms that can be found at the bottom of our website, as well as the bottom of all of our email communications. And that information has been placed in the chat. So the next slide, thank you. This concludes our presentation for this evening. And so now what we're going to do is we're going to transition into the Q&A portion for tonight's event. And we will begin answering any questions that were submitted to us in advance of tonight's session. And I believe at this point, we will be moving to David, who will be reading some questions and answers.
Yes, thank you so much. Yeah, so we're going to start with some questions that have already been submitted from you in your region that we're doing tonight, that we're presenting to tonight. And before I actually go into the questions, we've received several questions about different topics such as child development, early childhood educator compensation, childcare assistance, data, program funding, etc. And a lot of these things are really not within the purview of the work that Birth to Five Illinois is looking to do. We encourage you, if you have questions along those lines, to visit the Illinois Cares for Kids website, which is the state's early childhood consumer website, education website, I apologize, to see if some of those questions, the topics are answered there, discussed there. We will make sure to put the chat, link in the chat there for you. Okay, so now let's move on to some of the questions we received for this region. I'm going to go ahead and read these here. So the first question we received are, what are the deliverables for the Birth to Five Action and Family Councils? Right, what are we working on here? So in year one, like I mentioned earlier, the councils will be working on connecting the families to services they were utilizing pre-pandemic. Now, per the state's directive, the Birth to Five Action Councils will deliver that full regional scan that I talked about, also known as the needs assessment of the early childhood landscape for that region. Now, this is going to happen by December 2022. So we're a couple of months away from that. This report will be generated with support from Illinois Action for Children as well. I want to make sure to mention that. Another question we received is, what is the time frame to stand up these Birth to Five councils? When can we expect to see some of the implementation of the work? And I think this was a question that was already asked, but Birth to Five is providing the statewide infrastructure, right? The staffing, the framework for these regions, for these communities. Councils will be developed based on community interest. There's no state timeline for when a council has to be brought up, meaning that we're not going to formalize an action or family council until we have the staffing positions first. Once those have been filled and we get that diverse community membership, then we can start introducing the councils on a rolling basis. But I anticipate this will happen per region, like I said, as we get those staffing positions and then move into actually filling those action and family councils. And the last question I want to bring up is, what is the state of Illinois already doing to encourage parents to take their young children to enroll in early childhood programs? So the state is currently running a statewide early childhood awareness campaign that focuses on family and community engagement strategies that promotes the importance of early childhood. The campaign is actually expected to launch this month. I know we're towards the end of the month, but very soon. As part of that campaign, the Illinois Cares for Kids website that I mentioned earlier is inviting all families to join Ready for K. And this is across the state. So what is Ready for K? If you're not familiar, it's a free research-based text messaging platform for families with young children. Families can expect to receive about 3 text messages per week with some fun facts and tips on how to engage with your children as they grow. Illinois families can sign up for this now, and we're going to put the link in the chat so you can sign up and share it with the families in your programs. And I believe that that is the last question. You know what? I have one more actually. Yes, I'm going to do this one right now. Why is the data on your website and the data that we shared during our February kickoff events outdated? Great question. We have received this question and we wanted to address it now. So a lot of the data that we showed in our February kickoff was from ICAM. If you're not familiar with that, that's the Illinois Early Childhood Assessment Map. It's a website, it's public information. Anyone can log on and see that. Now, the thing with ICAM is a lot of that information is not very up to date really at all. Some of that information is a year old, up to 2 years old. It's collected by state agencies and they end that following fiscal year. If that makes sense. So the demographics that it pulls from, like the US Census data, all that is end of year release data. So the data that we presented could have been a year or two, and I bring this up because this is exactly why Birth to Five Illinois is so important. We are essentially building a structure in which we will have real-time data on what is happening on these different regions throughout the state at any point in time. It'll be more accurately measured than any current data point that we have now. And that's why it's so important that you help us spread the word about these family councils, about these action councils, that we start working on these regional scans. because all the data that we're collecting from these state agencies is great, but it is absolutely not the most up to date. We are trying to put that into the work we're doing now. So great question. Did want to end with that. So now I think we are going to move into any questions you might have tonight. I'm going to pass it over to Jess.
Thanks, David. I'm going to go ahead and read the ones I already answered so that the interpreter can also make sure Spanish speakers are getting them and folks who aren't able to read the Q&A box. Tabitha asked when the commitment to join the Action Council starts. And so I gave a similar answer to you, David, about once we hire the regional managers for that region as the first step, that's when the commitment will begin. Cicely, I don't know if you wanted to add anything about that question, when the commitment starts, if they're going to all be on the same timeline.
No, I mean, once we hire the staff and if there's enough interest in the community, we can start. So there's not the same timeline because every community has shown different interest. I will say in DuPage right now, well, I'll leave that for later. Let's finish the questions and I can elaborate on what's happening in the current communities on the phone.
Yeah, and I know DuPage has a ton of, probably the most of any region interest right now. The last I checked the forms, yes, David's clapping. We had another question come in from Darby. If you can be on the selection committee, if you know someone who's applied to be on the Action Council, yes, you can just disclose that to us and you can be excused from reviewing that specific form, but that's not an issue. The issue is that you can't be on the selection committee yourself and yourself apply to be on one of the councils.
And let me elaborate a little more on how we hope to use the selection committee. Again, all of this is a framework that only works if we have people who are interested. So the selection committee, what we plan to do in the state office is once the applications come in to remove all of the identifying information, so any names or addresses or anything like that, so that hopefully when the selection committee is looking at them, they can be as unbiased as possible. And so that's kind of the effort that we're going to make there. And, you know, so Darby, to your point, hopefully, even if someone you know is applying, you won't know who they are just based on their answers. Then it looks like there's 2 more questions in here. Oh.
Yep, I just typed one saying that you're about to answer it. So the question was, oh, I lost it.
I have this one. Can you explain what the relationship will be with the Early Learning Council and the Regional Council? So the Early Learning Council, for people who might not know, is a statewide council that's focused obviously on early learning and is currently run by the Governor's Office of Early Childhood Development. And so they kind of had taken a little bit of break in restructuring. And so we will now be assigned to the subcommittee that I think is called Community Planning and something. I can't remember the exact name of it. So our team will interface there. We will, you know, I don't know if we will necessarily sit on there, but kind of our scope of work will be assigned to that subcommittee. From the last ELC meeting, it sounds like they're probably going to be another month or so before they officially announce or vote on those subcommittees. And so Dr. Jordan has asked us to put together a couple of kind of questions or scope of work we'd like that committee to help us think through. And so as we are directed there, we will continue to work with that subcommittee. And let's see, there's another question. What will be the total funding that is available to local collaborations? And will the councils be decision makers to those grants? And so our total funding through the 2.5 years, I know it's a kind of wonky fiscal year with the state because it goes in June. Our total funding is $3 million. That's split across implementation grants, which are going to be for current collaboratives already up and running, and then also planning grants for communities that don't have local collaborations that would like to start kind of the planning conversations around launching a local collaboration. And so, as I mentioned, Angela is our staff who's working on that. Kind of, we're trying to make that as accessible as possible. We do have some requirements that through using federal dollars and as staff of INCRA, we have to comply with. So we're working through making that as easy to access as possible for local collabs. In terms of decision makers, there is going to be a matrix that we've been working with the state's Office of Diversity, Equity, Inclusion. They're making a matrix for the selection committee. They're also going to help with the matrix for that. So it will be a public matrix. It will be, you know, scored like others are. I do not believe there's a plan to bring in local councils to make those decisions because there's just not local collaboratives everywhere. And so that might put some people as a kind of, I don't want to say underdog, but unfair advantage. In the long term, I know there has been lots of discussions about where Birth to Five lives within the state governance long term, and that might be something that if we, become a legislative into the state legislator and codified in some kind of way, that might be a role for us long term, but that is not our role now.
These are some great questions. While we wait for other questions to come in, you can continue to type them in the Q&A box. You can also click the raise hand button on the bottom of your screen and we'll unmute you if you prefer to ask it out loud. Karina, I want to invite you if there's anything you want to share, say at this point. I know.
Actually, before you go, Karina, I don't want to lose my thought. Can I say one more thing, please? I'm sorry, just because my memory is not very good. So I know DuPage is on this call, and DuPage has a collab that works across the region called DEC. I'm sorry, I don't remember exactly. I imagine it's DuPage Early Childhood Coalition, maybe. I'm sorry, I don't remember the exact name. But Sonia and I have been meeting with leadership there. And I know they're in a little bit of a transition as a committee, but our goal for collabs like DEC, and I think there's about 4 other ones across the state that are already working on a full regional level. When we say regional, we mean just sharing the geographic boundaries that we have, is to try to figure out how we can expand and build upon their work. We have no desire to come in, be the new kid in town, take over anyone's thing, take any credit for anything. We really just want to leverage the resources we have to expand the work that you've already been doing. I know that some collaborations have been working with Action for Children, who is contracted to provide our technical and training support, and they've done some slot gap analysis and some planning with Action. The regional scan that we're looking to do is a little bit more extensive. Doesn't mean that what you've done is not valid or we won't use it or Action won't use it, but we will be building onto it. We also will be asking those regions to look at their current membership of their probably like steering committee or executive committee and trying to establish or trying to work with us to see what voices are missing. And so we can simply expand. We're not looking to ask people to leave and such like that. We're really going to look to expand voice, as David said, to make sure we're bringing in new voices wherever possible. And so we're having those conversations with DuPage right now and a few other regional collaboratives. So I did want to point that out since DuPage is on the phone. So looks like there's 17 folks who have filled in an interest form for the Action Council and 2 for family. Some of those 17 might be current members of DEC. We did ask them to fill that out just so we understand who is currently in the group. And for West Cook, it looks like there's 5 Action Council interest forms and 1 family. So I did want to kind of throw that in there to clarify for folks who might be here and have heard about DEC and wondering what that relationship ultimately might look like. All right, Karina, back over to you.
That's perfectly fine. That was important information. I just want to again remind everyone that as we're building the regional action councils, we are looking for community stakeholders. So people of all levels that represent the community. If, for example, after you've reviewed this information, you've talked it through, you've thought about it, you may feel that maybe you're not in a position to join the Regional Action Council, but you may know people in your community who would be in support of this initiative and who could bring the voices necessary to move the work along. So I just want to encourage you to share that information with me. It could be someone that you're interested in referring. It could be a family church member, a family member, your banker, someone at the local chamber of commerce. That would be of great assistance to have that information and serve as an introduction for us as we are basically trying to do the groundwork and reach everyone that represents the communities that we are, for lack of a better word, and assigned to and trying to build collaborations. So just want to encourage you to please email me. Let me know that you attended the webinar this evening, and or if you want to have a conversation, we can schedule meetings. If you are part of other entities where a presentation would be beneficial, I'm available to do that as well. So just wanted to make sure that people are aware of what my role is. And thank you, Jess, who has placed my email again in the chat. You can contact me that way as well. But I'm glad to see so much of DuPage, and that DuPage is #1.
Chicago West is also showing up pretty.
Thank you. Yes. That's
Another thing I want
wonderful.
to add in, because some people might be like me, I'm a little bit of a like, sit back and listen first. And so if you do not want to fill out an interest form, you're not interested in joining, you want to see what we're all about, that's totally fine. We're going to have kind of rolling. So, it's not as if we're going to have like, you join in whatever June, and then we're not having another, campaign until June. We'll always be looking for input. And even as I think David said, we're looking for kind of maybe 15-ish or so people to join these councils, just so they're a workable number, not because 15 is anything magical. But these councils, and particularly our staff, will still be charged with going out into the community. And Karine will be around until at least December. And so she will support whatever staff we hire, and they will need to go out into the community and get input. And so it's not as if these 15 people, if you don't join now, or, don't have the capacity to do one more thing, that we won't still need your input. We want to make sure that the reports we put forward obviously have the most up-to-date data, but we really want to get that qualitative piece of what community members want, how parents and how providers are experiencing the current early learning, and how they want to expand it in their community. And so there'll be plenty of opportunity for you all to get engaged once the councils are up and going. Obviously, we'll have a link on our website with their calendars and all those kind of things, and who you can reach out to if you have questions there. There's a question about a recording. The recording will be on our YouTube page. Jess, can you pop that in the link? Thanks. Any more questions? We appreciate you all who have been here a few times to listen to the same thing. We've refined our message as we've talked to community. So if things have changed, it's not because we're trying to slip a fast one over you. We've really just tried to respond to feedback that we've gotten.
As we wait to see if any other questions come in the Q&A box, or again, you can click the raise your hand function to speak out loud. Grace, we can go ahead and pull up our last slide again and start to close out, but please don't hesitate, y'all, if you have any other questions, to go ahead and ask them.
So these are our interest forms as we've gone through already. Obviously, our website FAQs, we've changed that as well. We continue to add them. So some of the things David read are from those, but some maybe from tonight were good questions. We might add those as well. I think that Jess provided Corinne's email address already. So there's many ways in which you can get in touch with us. We also have, again, Spanish and Polish on the website, as well as all the forms in Spanish and Polish. People have asked about accessibility at the regional councils once they get up and running, and we are totally committed to accessibility. And so whatever accommodations people need, we will work our hardest to make them available at the meetings. And that will be something that is also something we require of our staff, that they make sure they focus on accessibility and inclusion. And so please don't let any of those things that might stop you from other participation stop you here.
That's all we have. It looks like there's no more questions. So with that, hoping you're going to get that extra 5 minutes of sunlight that I could still see out my window. Thank you. Thanks, Janine. Thanks, Denise.
Thank
Have
you
a
all
good
for
night.
coming.